And hospitals have really stepped up, and I appreciate that. By shifting inventory around, we're going to be able to increase the number of shots this week by about 20%. That's about 40,000 more shots by this Sunday, on top of the 175,000 that were already planned, and that is good news. One of the leaders in this effort, and he has been here before with us, is Dr. Mike McDermott, CEO of Mary Washington Hospital in Fredericksburg. He has really stepped up, as have a lot of CEOs from other hospitals, and I'd like you all to hear from him today. So, Mike, thank you and welcome.
Thank you, Governor Northam. Good afternoon. I'm Dr. Mike McDermott. I'm the President and Chief Executive Officer of Mary Washington Healthcare in the Fredericksburg area. I'm also the immediate past chairman of the Virginia Hospital and Healthcare Association. I want to thank Governor Northam for the opportunity to be here today and for the administration's ongoing collaboration with hospitals and healthcare providers across the Commonwealth as we continue to battle COVID-19, the pandemic, and we also work to vaccinate Virginians as quickly and safely as possible. Overall, Virginia hospitals have administered more than 318,000 vaccine doses since mid-December, and we are proud to help lead the way in this critically important, life-saving work. To give you an example of how fast vaccination capacity is scaling within our hospitals, Virginia hospitals have increased vaccinations by 35% in the past week. The population of people vaccinated so far includes hospital staff, other healthcare professionals, and more recently, essential workers and vulnerable Virginians who are now eligible to receive vaccinations. As I look back at the last month, a few observations come to my mind. First, I was surprised that the federal Operation Warp Speed in the previous administration did not include plans for the last 12 inches of the vaccine effort, getting doses into arms, arguably the hardest logistical task in the process. Second, the lack of transparency from the previous federal administration preventing appropriate preparation for that formidable task. Nevertheless, our Commonwealth got to work, and we got to work at Mary Washington Healthcare. We immediately began our vaccination program with a paper-based system. We used that in our field hospital that we had converted early in the pandemic. Fast forward just a month, and we have since expanded to a fully digitized operation in our nearby Fick Conference Center on our hospital campus. And if I may, I'd like to just take a moment to tell you a little bit about that clinic. When our clinic is running at full capacity, we are currently able to vaccinate more than 2,000 scheduled people per day. When cars arrive, they are greeted, arrival is noted in our system, and they park to wait for a text message to be told to come inside to receive their vaccine dose. We do that to manage the number of people in the building at any time. Our scheduling system and on-site logistics work to efficiently move people through the process from registration and check-in, vaccine administration, to observation and second dose scheduling, and then departure. Many have marveled at this process, gushing that our operation is smoother than a Chick-fil-A drive-through. It's difficult to think of a greater compliment. Inside the clinic, the positive energy is palpable. It's an environment full of excitement and gratitude from patients and the clinic staff's satisfaction about being a service to our community. As a physician, I have done vaccination shifts myself at the clinic, and I can tell you that afterwards, you emerge filled with hope. As we look back, it's been a difficult year, and we've all been forced to sacrifice in many ways to help combat this global pandemic. But we've been resilient, we've adapted, and we've endured. I saw a great cartoon the other day where a child is looking up at her mother's upper arm, a round mark on the upper arm, and the child inquires, "What is that?" And the mom responds, "It's my smallpox vaccine scar." And the child asks, "How come I don't have one?" And the mother's response is, "Because it worked." Now we're fortunate to be receiving and distributing new doses of hope to our community, paving the path out of this pandemic to a brighter future. To give you some perspective on our progress, we've administered more than 16,000 vaccine doses so far at Mary Washington, over half of those in the last week alone. This week, we expect to administer another 8,000 vaccine first doses. We currently have the capacity to do more than 2,000 doses a day, and our team has plans to implement even more capacity. We have a very strong partnership with our local health department and a shared purpose of working to vaccinate our Rappahannock region. I've shared with you our experience at Mary Washington Healthcare, but many Virginia hospitals have built similar clinics in a very short time, creating a tremendous amount of scale to be ready to administer more vaccine doses to our fellow Virginians. Across Virginia, hospitals are currently capable of administering more than 100,000 doses each week if there is adequate supply. Many other hospitals across the state have also set up clinic sites in partnership with local health departments and community organizations. In this past month, we have come so far. The metrics improve daily as systems get interfaced and caught up from our initial paper-based processes to be formally accounted for in the digital systems to reflect our true efforts to date. This administration is actively sourcing and redistributing vaccine to ensure timely administration of all available vaccine doses to citizens of the Commonwealth. Only a month into our efforts, we now share a common challenge, a limited inventory of vaccine doses based on what the federal government is able to send to the state. Under these challenging conditions, we're appreciative of proactive steps taken by the Northam administration to move even faster and get doses into the hands of people and organizations who can use them. As hospitals, we stand ready to support the Commonwealth in rising to the occasion by ensuring we have the capacity to administer these COVID vaccine doses to our fellow citizens. We have built an engine to help power this effort. We just need fuel in the form of COVID vaccine doses from our federal government to propel us forward to our brighter future. Thank you very much.